So when a patient comes to us having any complaints of the deviated nasal septum, we examine his nose under the headlight. Any deviations present in the front part of the nose can easily be identified with the headlight. But you have to remember, the nose is a very deep structure extending from the front of the face all the way to the back, just above the throat. So we prefer to do a diagnostic nasal endoscopy, where we send an endoscope from the front of the nose to the back to identify any further deviations. Also, if we are suspecting any sinusitis symptoms in the patient, we may advise CTPNS, that is CT scan of the nose and sinus. At our sinus doctor center, we specially do a test called rhinomanometry, where we try to identify the extent of the nose block. This test we specifically do in patients who have already undergone septoplasty or sinus surgery but are still experiencing nose block. So how do we treat a patient having deviated nasal septum? See, deviated nasal septum is a very common problem. If the patient is having mild symptoms which is not very troubling for him, we would advise simple medications like nasal sprays, nasal washes and antihistamines. But if the patient is having very troubling symptoms, he is having difficulty to sleep, he is having difficulty to perform his regular activities normally, then we would advise a surgery called septoplasty. This septoplasty takes anywhere between 1 to 2 hours. It is usually done under general anesthesia and sometimes under local anesthesia. In this surgery, we remove the deviated part of the nasal septum.